Hey everyone, I wanted to talk about anemia. I thought I'd do a really quick tutorial about this while I'm finishing up my hike. So the idea is when I get somebody that has an anemia or a persistent low blood count, it's important to figure out why. There's a couple reasons. Number one would be that you're not producing enough red blood cells. And we'll talk about how to detect that in a second. Number two would be that you're destroying red blood cells too quickly. Average red blood cells should last in your system for about 3 months, and usually because a cell becomes senescent or old, if it can't keep up its activities properly, and red blood cells are in our bodies to carry oxygen from the lungs to distant tissue. Well, if it can't perform the job properly, you got to get rid of it. And I'll talk about that in a little bit. And the final reason would be that you're losing it too quickly. The reasons for not making enough red blood cells, or good size red blood cells, are really too numerous to go through. We actually have a specialty called hematology, and the hematologists are very busy. Mostly because when primary care docs get a checkup and we find a low blood count, if we repeat it and it's persistently low, it's important to call in the specialist. The common reasons for a low blood count would be nutritional. Sometimes when you don't have enough iron in your system, or you don't have enough B12, then you're not going to be able to make proper amounts of red blood cell. And when the system is bogged down, doesn't have enough building blocks, it'll just produce the basic minimum. Clinicians can tell about whether it's pointing towards B12 deficiency or iron deficiency based on something called indices. Indices are the quality of how big the red blood cell is and how much hemoglobin is contained. The obvious treatment would be you start taking in those supplements, repeat some blood tests in a couple of weeks to months, and if it still is low, you got to go to the next reason. The other reasons for not producing enough red blood cells would be that those systems in the body that are supposed to be responsible for creating a certain amount per month, like the kidney and its secretion of erythropoietin, or the bone marrow and its function. In some cases, bone marrow can be irritated or busy. And sometimes you can be on some medications that'll destroy or affect the bone marrow. So it is important for your doctor to review what you might be taking prescription-wise and also what you might be taking over the counter. Believe it or not, proton pump inhibitors like omeprazole, Prilosec, Prevacid, Nexium, they are good for decreasing acid, but they also decrease B12 absorption, in addition to a little bit of iron. So when you take them chronically, and if you look at the black box warning on those things, they're only supposed to be used for about 3 months and then you're supposed to stop. But I have people walking in with chronic use of those things, years at a time. So usually when I have somebody that comes in with chronic reflux or Barrett's esophagus, I'd always run a B12 level. Hopefully the GI specialist who's monitoring that for you will do that, but it's often overlooked. The cool thing when you're B12 deficient is when you make up the B12 in injection form, it really gives my patients this little bit of energy versus the oral form, which I don't get. I'm a semi-vegetarian, so I have to take B12, and I don't seem to get that energy burst everybody speaks of when they get the shot. The one problem with iron deficiency is that usually when you take the iron, it causes constipation. So even though the treatment plan would be to supplement your diet with natural means of B12 and iron, you can have a problem with the side effects of the supplement. So anyway, once you get back to repleting those things in your diet that are depleted, you hopefully will notice blood test results that improve with time. If you still have problems, as I mentioned, it's up to the doc to do further workup. Sometimes when you have inherited disorders like sickle cell anemia or thalassemia, you will chronically be anemic. You probably won't have any shortness of breath, fatigue, or intolerance to exercise, but it'll be something that usually is found when you're a child or when you're younger. That does not mean that your doctor is just going to ignore the possibilities of being B12 deficient. You should still check into B12 and iron. But usually when that's declared as you're younger, every time you get blood tests, it's important to tell your doctor that, oh yeah, by the way, I've been found to be anemic. Darn, this is a dead end. So the usual reason for having a deficiency like iron or B12 would be food groups. And as I see a lot of vegetarians, usually people who eat a plant-based diet don't get enough iron and they don't get enough B12, not to mention vitamin D and magnesium. So it always depends on what your nutrition practice is. It also depends on when you do cook or prepare your own foods, where you get your harvest from. If it's non-organic, we hope that our farmers are treating the soil properly and cycling their crops, but in mono-agriculture, the likelihood of pesticide use and soil depletion is high, so you always have to vary where you buy your produce from. And obviously, if you're a female and you're menstruating on a regular basis, that will be the reason for losing the iron. So I might as well jump ahead to the other reason for anemia, which is loss. When you have a menstruation, common. And usually those dummy pills that the birth control packs have contain some form of multivitamin or iron, which is nice. At least you're getting an iron supplement once 1 week a month. But it is wise to be on a multivitamin if you are taking birth control. Most Americans really should be on a multivitamin, considering that the standard American diet is usually lacking with nutrition. As far as how to pick a multivitamin, I usually go with Consumer Labs, but it kind of depends on what's available in your local vitamin shop or even online, but always research the company that you buy from. One of the big reasons for losing red blood cells and thus iron would be bleeding from the gastrointestinal tract. So the common thing is to have polyps, and as you get older, polyps usually are found by colonoscopy. So that's when we send you to the GI specialist. Once an anemia is found, if it cannot be corrected, if we find during the physical exam that you have blood in your stool, or what's called a heme positive stool, it'd be wise to get over to the GI specialty. Sometimes we'll do that before sending to the hematologist. If there doesn't seem to be any reason for bleeding in the gastrointestinal tract, then the hematologist is called in for his expertise. Young people usually don't have problems with polyps. The other reason is bleeding from the upper gastrointestinal tract, ulcers. Ulcers, gastritis, even reflux can cause problems with anemia. It is important to have a GI specialist on the case, because not only can he do the colonoscopy, which looks for bleeding from down below. That's a procedure that essentially takes less than an hour. There's also upper endoscopy that looks into the esophagus and the stomach and a little bit of the duodenum. In my day, we used to, before the advent of scoping, there used to be upper GIs that we would do and something called a small bowel follow-through. That's when you drink barium, get an x-ray, and you watch the barium go down from the esophagus to the stomach to the small intestine, and you take pictures. And usually the radiologists are really good at evaluating the pictures, kind of like the silhouette of the gut, looking for signs of ulcerations. There are some rare causes of valve dysfunction that also cause bleeding or tearing up of the red blood cells as they pass through unusual valves or malformed valves, sometimes even prosthetic valves in the heart, but that's really rare. Or autoimmune disease, where the body mistakenly attacks its own cells. and in this case it would be attacking the red blood cells. Again, those reasons are rare. So overall, if you're suffering from or have been diagnosed with an anemia of some sort, the usual plans are what I mentioned, and it is important to follow up with your doctor. And it usually is about 3 months before the next blood test is done, and then possible referral or supplementation. Even if you don't have any symptoms, it is important to invest in that blood test and the follow-up. The human body is very resilient and has excellent reserve. But if you're going through stressful times, training in an activity of some sort, when you're anemic, you put excessive stress on the body, and it would be important to maximize on essentially having a full tank of gas whenever you're going through your endeavors. The obvious problem is when you suffer from fatigue, you can't think properly, or your activities of daily living, your tolerance is poor. When that happens, then it's usually a matter of somebody finding it on blood testing after you get into the office. There are some physical signs of anemia. If you're lucky, you might be able to find it on your own, as far as pale conjunctiva, pale mucosa or mucous membranes, but it still requires investigation with testing. Worst case scenario is in underdeveloped countries, when the heart has to do its usual duties, working with what I consider half a tank of gas, the heart has to pump harder because there's less red blood cells to take oxygen from the lungs to the tissues. So when the heart has to pump harder, it gets bigger in time. That's a setup for congestive heart failure. I've seen it in the Philippines, and it's evident in developing countries. You usually don't see it here in the United States because the access to medical care is so easy. Sometimes if you don't have insurance, and can't see that happening nowadays, a cheap way to check your blood is actually to donate blood. When you donate, before they take your blood, they always check some basic blood tests. So overall, if you do suffer from an anemia and you have no symptoms, it is important for follow-up. It is important to reverse it. And if you can't get to that point, it is important for second opinion. Hopefully this has been helpful. Don't forget to give me a thumbs up if you were able to apply this information to your own lives, and subscribe to me for weekly words of wisdom.